Now, the number of people waiting for a first appointment at an NHS gender identity clinic in Scotland has increased fivefold in 5 years. The number's risen from under 1,000 in 2018 to more than 5,000 at the end of last year.
GPs say the delay is putting them in an impossible position of trying to care for patients without expert support. The Scottish Government says waiting times for gender services are too long and that new guidelines are due to be published. Our health correspondent Lisa Summers has more.
I can remember those feelings of not quite fitting in, but I was still fairly happy. I had a really nice experience growing up.
At the age of 27, Winter was referred to Glasgow's specialist gender clinic. She's one of over 3,000 adults waiting for a first appointment. She's already waited 2.5 years and has no idea how long it'll take to be seen.
The way that things are at the moment, it makes it very difficult for a lot of trans people to access any sort of care through the NHS. Even just for the early stages, if you're just questioning your gender identity, most GPs will just kind of take your initial feelings and then put a referral through. It's very hard for a lot of people to actually find an avenue to talk with someone professionally.
Faced with such a long wait for help on the NHS, Winter paid to see a private GP who prescribed hormones.
Transitioning, it's been one of the best experiences I've had. I feel like I haven't been quite so happy in a long time.
When the Scottish Government dropped its legal battle over gender recognition, it said that it would improve healthcare for trans people. Yet waiting times for adults and children at clinics like the Sandiford here in Glasgow are getting longer and longer. Balancing the role of specialists here with GPs working in the community was also due to be addressed in a new protocol ordered by Scotland's top doctor. But 2 years down the line and there's no sign of it, with doctors saying there's still a lack of clear rules on how to achieve the best healthcare for trans patients.
How are we doing for appointments today?
In the meantime, that leaves GPs as the only point of contact with the NHS for most trans patients.
I think it's brought a lot of frustration for us and our patients, and I think sometimes patients feel that we should be able to be doing something differently or more, but we have to be safe in our medical care. What we don't want to do is put in shortcuts and have GPs prescribing when we haven't looked at all the risks, when we haven't done a full assessment, because we wouldn't want that. That's reducing our standards of care, actually. So I think for a small number of GPs, it puts them in an impossible situation, but it also puts those patients in an impossible situation.
The government accepts waiting times are too long and says it expects to publish the new protocol in the spring. It says it's part of ongoing work to improve access to gender healthcare. But even when patients get into the system, they have to wait. Eli was first referred in 2018, but is now waiting for surgery.
That gap between GP services and gender healthcare specialists is more people that are sort of waiting, more people that are suffering stress, and it's all just to sort of feel more like ourselves.
Eli doesn't know how long he'll have to wait, but until he completes his transition, he feels his life is on hold. Lisa Summers, BBC News.